Well, when we're thinking about a pharmacological treatment plan, the first step is really, of course, making sure you've got the diagnosis right and you've assessed the patient's symptoms and any other conditions properly. So it's really important to think about symptom severity, but also the associated level of distress and maybe impairment, so that to establish what it is that the patient can no longer do that they used to be able to do before they become unwell. So assessment really is the first stage. It's really important also to think about preference. Many patients have a strong preference for one form of treatment over another, often for a psychological treatment rather than a drug treatment. And it's really important that you kind of make a proper decision which incorporates patient preference. But let's imagine that there is a patient that seems right in a way to have a pharmacological treatment, and that is their preference. You need to warn people about potential side effects in the first few weeks of treatment, such as a slight increase in nervousness or maybe a greater difficulty in falling asleep. People often don't want to hear that. They're wanting a kind of an immediate reduction in their symptoms, but it is helpful to warn them that there may be potential side effects in the first few weeks of treatment. The general advice from clinical guidelines is to start at a low dose to make sure that people are tolerating that okay, and then to steadily increase it towards the lowest effective dose. And then to continue with that for a number of weeks. Now, that might differ from disorder to disorder, but probably 6 to 8 weeks is long enough before deciding whether or not a treatment is working. If at 8 weeks that there's no evidence that someone has improved, you need to think about something else. It might be increasing the dosage, maybe incorporating a psychological treatment, or again, looking at maybe other factors which could be maintaining their symptoms, such as, excessive alcohol consumption, or social problems such as a difficult or coercive relationship. So to think about potential maintaining factors at 8 weeks, but if someone doesn't have those and hasn't responded, then maybe at that point you need to think about something else. Usually that would be incorporating a psychological treatment if that's not being used already.